You finally climb into bed, exhausted, ready for sleep. But the second you lie still, your legs start to tingle, twitch, or ache with this irresistible need to move. You stretch, you pace the hallway, you try a cold pack, and eventually you crash, only to wake up unrefreshed. If that sounds familiar, you may be dealing with restless legs. And here's the truth. It's not just in your head. It's a real neurological condition called Restless Legs Syndrome, and it affects millions of people, with women in midlife being especially vulnerable. Today, we're unpacking what restless legs are, why they often appear or worsen after 40, and what you can do, starting tonight, to calm your body and get better sleep. Restless leg syndrome, or RLS, is a condition that creates an uncomfortable urge to move your legs. It often comes with sensations people describe as crawling, tingling, aching, pulling, or even little electric shocks. Here's the classic pattern. Symptoms get worse when you're at rest, especially when sitting or lying down. They're more intense in the evening or at night, and the only temporary relief comes from movement, walking, stretching, pacing. Some people also have periodic limb movements in their sleep, jerks or kicks that they don't notice but that fragment their rest. This is why restless legs can be so exhausting. It's not just about your legs, it's about how much your sleep and daily energy suffer. So why does this condition often show up or worsen in midlife? There are a few key reasons. First, hormonal changes. During perimenopause and menopause, estrogen and progesterone start to fluctuate and decline. These hormones influence dopamine, a brain chemical that regulates both movement and sensation. When that balance shifts, it can trigger restless leg symptoms. Second, iron and nutrient issues. RLS is strongly linked to iron deficiency in the brain. Your blood iron may look normal, but your brain's iron can still be low. Women are more prone to this because of years of menstrual loss, pregnancy, and sometimes lower dietary intake. Other nutrients like B12, folate, magnesium, and vitamin D also matter for nerve health. Third, sleep disruption and stress. Midlife often brings fragmented sleep from hot flashes, caregiving responsibilities, or career pressures. Lack of sleep itself can worsen restless legs. Add in elevated cortisol from chronic stress, and the cycle keeps spinning. Fourth, underlying health conditions. Things like diabetes, thyroid issues, kidney disease, or peripheral neuropathy become more common with age and can fuel restless legs. Finally, medications and lifestyle. Some antidepressants, antihistamines, anti-nausea meds, or even stimulants and too much caffeine can trigger or worsen symptoms. Put this all together: shifting hormones, nutrient depletion, stress, health conditions, and lifestyle factors. And it's clear why restless legs often make their debut in midlife. Here's a quick checklist. Do your symptoms start or worsen in the evening or when you're resting? Does movement bring temporary relief? Are your symptoms strong enough to disturb your sleep? Did these issues start or get worse in midlife? If you said yes to most of those, restless legs is likely. It's important to rule out underlying causes, so here are some useful tests you might want to discuss with your doctor. First, a ferritin and iron panel to check your iron stores. Then, a complete blood count, which can help identify anemia. Thyroid function tests like TSH and free T4 are also good to consider. Don't forget about vitamin B12 and vitamin D levels. If you have diabetes or any kidney issues, a metabolic panel can be really helpful. And make sure to bring a list of your medications, since some of them may actually worsen symptoms. For more severe cases, your doctor may even recommend a sleep study to measure leg movements and sleep quality. Now for the part you've been waiting for, what actually helps. So let's start with lifestyle first. Keep a consistent sleep routine. Dim the lights, wind down, and aim for the same bed and wake times each day. Move your body during the day, especially with leg-focused activity, but it's best to skip those intense workouts right before bed. Audit your caffeine and alcohol. Try to cut back on both, especially in the evening hours. You might want to try magnesium glycinate in the evening, but definitely check with your clinician first. Stretch your calves and hamstrings, do some gentle massage, or use warm and cool packs before bed. Compression socks may help if swelling contributes to your discomfort. And here's a pro tip. Keep a simple journal. Write down when your symptoms start, what you ate, what you tried, and how you slept. This is gold for figuring out your triggers and sharing with your doctor. If your ferritin or iron is low, your clinician may recommend iron supplementation. But don't start iron without testing. It's really not one size fits all. For moderate to severe restless leg syndrome, medications may be considered, including dopamine-modulating drugs or certain nerve-calming medications like gabapentin or pregabalin. These can be helpful, but they also come with side effects, which is why medical guidance is so important. If your symptoms are disrupting your life, ask for a referral to a neurologist or sleep medicine specialist who works with restless leg syndrome. Before we close, here's a calming reset you can try tonight. 90 minutes before bed, dim the lights and shut down screens. 60 minutes before bed, take a warm shower or bath. 30 minutes before bed, stretch your legs and practice a few minutes of slow breathing. If approved by your doctor, consider magnesium glycinate. Keep a short note of your symptoms and what helped. Small, consistent steps like this often make a huge difference. Here's the takeaway. Restless legs in midlife are common, but they are not your fault. They're your body's way of saying something needs attention, whether it's hormones, nutrients, stress, or sleep. And with the right support, you can absolutely reclaim restful nights. If this video helped you, please like, share, and subscribe. It really helps more women find these conversations. At Leap 2. Better Health, we help women over 40 reconnect with their bodies and redefine wellness in a way that's real, sustainable, and rooted in science. Book your free consultation today, and let's create your personalized roadmap to better sleep and better health. And tell me in the comments, what's the first step from the nightly reset routine that you'll try tonight? Your answer might just inspire someone else. Sleep well and be gentle with yourself.